Հաղորդման հովանավոր Dignity Health Glendale Memorial Hospital.
I'm Dr. Minayan. I'm a neurologist with subspecialty in vascular neurology. I practice at Dignity Health Glendale Memorial Hospital. Today I want to talk to you about memory care and the 5 factors or tips that could prevent memory loss. And they include diet, exercise, stress management, mental stimulation, and good sleep hygiene.
Բարի երեկո սիրելիք բարեկամներ։ Այսօրվա մեր թեման է ֆլու էպիդեմիկը, որ Կալիֆոռնիա նահանգի մեջ ավելի 100-ը ավելի մարդիկ մահացած են եւ LA County-ի մեջ այս տարի մոտ 33 մարդիկ մահացած են։ Մեր ստուդիոյի մեջ ունենք երկու բժիշկներ, թե հիվանդանոցի կողմը եւ թե urgent care-ի կողմը պիտի խոսին այս թեմայի մասին։
Կալիֆոռնիա նահանգը տարին մեկնարկեց գրիպի առավել ծանր սեզոնային համաճարակի դեմ պայքարելով։ Գրիպի սեզոնային համաճարակը սովորաբար մեկնարկում է հոկտեմբերին եւ ավարտվում է մայիս ամսին։ Սակայն ի տարբերություն նախորդ տարիների, այս տարվա H3N2 վարակը շատ ավելի արագ է տարածվում։ Հիվանդության տենդային վիճակը գրիպին բնորոշ 3-ից 5 օրվա փոխարեն տևում է մինչև անգամ 10 օր։ Ախտանիշները շատ ավելի ծանր են դրսևորվում, եւ որն ամենակարևորն է, ի տարբերություն նախորդ տարիների նույն ժամանակաշրջանում գրանցված տասնյակը չգերազանցող մահացու դեպքերի, այս տարի Լոս Անջելեսում եւ Սան Դիեգո Քաունթիում նախնական տվյալներով սեզոնային գրիպն արդեն մի քանի տասնյակ կյանք է խլել։ Կալիֆոռնիայի շտապօգնության կլինիկաներն ու հիվանդանոցները գերծանրաբեռնված են։ Դեղատներում դեղամիջոցների, հատկապես գրիպի դեմ խորհուրդ տրվող Թամիֆլու միջոցի խիստ պակաս է գրանցվում։ Գրիպի վարակը տարածվում է օդակաթիլային ճանապարհով։ Հիվանդության գաղտնի շրջանը 1-ից 2 օր է։ Հիվանդությունը սովորաբար սկսվում է դողով, ջերմության բարձրացմամբ։ Հիվանդի մոտ լինում են ընդհանուր թուլություն, գլխացավեր, գլխապտույտ, անքնություն, ցավ ակնակապիճներում եւ գոտկատեղում, մարմնի ջարդվածություն, ցավեր հոդերում, մկաններում եւ ոսկրերում, չոր հաս եւ փռշտոց։ Նկատվում է արյան ճնշման անկում, սրտի զարկի դանդաղում։ Գրիպին յուրահատուկ են մի շարք բարդություններ, որոնցից ամենածանրը թոքերի բորբոքումն է։ Գրիպի առավել հաճախակի բարդություններից են բրոնխիտը, միջին ականջի եւ քթի հարակից խոռոչների բորբոքումները։ Գրիպը կարող է սրել սրտանոթային համակարգի հիվանդությունները, բարդանալ վիրուսային մենինգիտով եւ էնցեֆալիտով։ Գրիպի բարդությունները խիստ վտանգավոր են հատկապես երեխաների եւ տարեցների համար։
Սիրելի բարեկամներ, մեր ինչպես մեր ստուդիոյի մեջ ունի երկու բժիշկներ, որոնք մասնակիցներ են այս թեմային մասին։ Dr. Manuel Momjian, որ urgent care center-ի պատասխանատու է, եւ Dr. Raj Jandial, որ հիվանդանոցի chief medical officer է։ Դժբախտաբար այսօրվա մեր հարցազրույցը պիտի կատարենք անգլերենով։ Բարի եկացեք։
Բարի տեսանք, thank you, Michael.
How are you, Doc?
Mike, how are you?
Good. Would you tell me a little bit about the epidemic this year compared to the years before? Because the concern is the worst in the decade.
So it's interesting because I've been practicing for about 10 years now, and this year has been by far the worst flu year that I've ever seen in terms of the patients coming in and how sick they're coming in. So it's definitely something that everyone can feel in the community, because if you don't know someone who has had the flu around you, then you're in the minority right now. Everyone has felt this throughout the community somehow in one way or shape or form. It's a very intense illness. It hits you very hard, very fast. It causes a very high fever, causes severe body aches. And this year, we're noticing it's just not going away either. It's lasting up to 10 days, 14 days sometimes. And there are lots of people with complications secondary to the flu as well.
So how do you know you got the flu? What was the first symptom?
Yeah. I mean, do you want me to answer this one, or?
Well, we're going to go to Dr. Jandial in a minute from the hospital standpoint.
Okay.
How do you know?
How do you know?
Maybe I say, oh, it's a cold.
Yeah. So basically, that's a very good question. And so the flu is number one. It occurs in the flu season. So usually comes with a group of patients all together, and then the the symptoms are characteristic because they are very intense, and like I said, it has a sudden onset. So it makes you feel like you got hit by a truck or someone just beat you up. And typically the way I describe it is, you are someplace maybe with some friends having fun, you feel good, and then within a second,
it hits you.
It hits you, and you want to get on the floor and just start shaking. Okay.
Because the first sign is you shake.
You shake. You have
fever.
You have fever. You have chills. Your body hurts like someone beat you up. So that's a characteristic feature of the flu. And you have the fever that starts initially on the first day like that is very characteristic of the flu. When you have things like, if you have other respiratory tract infections like a pneumonia, these things, usually the fever starts later on. It doesn't start on the first day. It starts like day 4, 5, 6, maybe day 8 or 10 after the cough gets worse and worse. So it's more of a slow progression, but the flu hits you on the first day with that strong fever. So a lot of times patients come in, they tell me the story, I already know it's the flu. I don't need to do a lot of testing to figure it out most of the time. But there are definitely tests that you can get done to make sure to confirm that you have the flu or not have the flu.
So what the first thing you do? You just give them medication saying go home and rest?
Actually, there's a doctor in my office. He said, you have the flu, nothing to do. He said that. I thought it was funny, but actually there's more to do with the flu because there are antiviral medications that actually this year seem to be working. I don't know if you guys have noticed that in the hospital, but I do notice that patients are telling me, thank you for prescribing this treatment. I feel better on this treatment. So there are medications that you can get prescribed. Unfortunately, there's been a shortage. Some of this stuff is in back order, and so you have to kind of go looking for it. My advice is to avoid large pharmacy systems like CVS, Rite Aid, because they're all out of this medication. They're all out of it.
That's what I've been hearing, that they're out of medication and there's not enough.
I would call the small pharmacies
to go and check.
Yeah, because a lot of them have ordered this many months in advance, and they have lots of stock of it, and they don't have as much volume as these larger chains. So I would go calling the smaller pharmacies. Those are the ones that have all the supply of Tamiflu, and you can find it. You can definitely find it in the community.
Have you seen a big surge of patients coming to your urgent care?
Oh yeah, oh yeah.
What was the average day, let's say, before the flu season? People telling me they doubled their visits. Our volume doubled pretty much during the flu. So, and you can't really tell when it's going to happen. So staffing becomes very difficult. So there's no way to anticipate that this week is going to be the flu week. So your staffing is the same, and that's why there's a congestion a lot in the waiting rooms. There's a lot of congestion, people waiting, and frankly, a lot of people. They just walk out if they don't have the flu because they're scared that they're going to get the flu. They're going to get the flu just sitting next to someone.
Sitting in the waiting room, they're going to get the flu. Absolutely.
Dr. Jandial, as far as the hospital, and we have seen a big surge in ER visits. I mean, some of our hospitals are reporting to me and to us that they doubled their visits. Have you seen that big surge, let's say, in November, December time?
Yeah, most definitely. I mean, at our hospital at San Dimas, we've had census in the last week or two of 80 patients with a capacity of 100. So we're really close to maximum capacity. And these are record numbers for our hospital. I haven't seen that in 15 years that I've been on staff over there. I wanted to backtrack a little bit about the flu that you were mentioning, is that the challenge with dealing with the flu is that we deal with the flu season every year, but most seasons are mild, and every 5 to 7 years we have a very severe influenza outbreak. And there's a sense of complacency that kicks in getting the flu vaccine because most years are mild and you don't have a lot of visits to the ER and admissions to the hospital. So prevention can be hard to kind of implement with patients because they just remember the last year's flu season. This flu season, what I'm hearing from CDC, that the vaccinations are about 30% effective for complete prevention. But here's the part, if you talk to infectious disease doctors, they still think that there's tremendous benefit in getting the vaccine because a lot of people have partial efficacy. So partial efficacy means that if they hadn't gotten the vaccination, they would have had a much more severe case of the flu. So you might get the flu even if you had the vaccine, but it's a much milder case. From a hospital point of view, really it's the elderly and the frail patients that wind up going to the ER for visits for the flu. Anybody who has any kind of underlying respiratory condition like asthma, COPD, diabetes, any of these comorbidities, they are the high-risk population that wind up going to the ER with severe symptoms. So as far as going to the hospital, if you're having fevers and chills, just as he has mentioned, and you have associated shortness of breath, and you have nausea and vomiting, you cannot keep food down, those are the triggers where I would recommend the patient go to the ER for evaluation. Yeah, okay. If you're relatively young and healthy, you don't have any comorbidities, you could probably ride it out just with symptomatic support. You don't necessarily need to an intervention. And last but not least is, I think there's a tendency for all of us to go to the doctor's office or call the doctors for an appointment, but really, you really don't need to. The best thing that you can do is call your doctor. Hopefully, he or she will prescribe you Tamiflu over the phone into the pharmacy, because right now is the peak season. We know if somebody's having these kind of symptoms that it is probably the flu.
So would you decide, as you were describing, have these severe symptoms to go to ER?
Definitely.
If it's a little bit milder, not as you were describing, go to an urgent care center or your doctor's office.
Or your doctor's office. But the key thing is not just the symptoms, it's how many other chronic ailments you have, what age group do you belong to, and those are the high-risk profile patients that really need to get attention fast, whether it's at urgent care or in the ER.
So anyone, let's say, over 65.
Definitely.
We have diabetes, high blood pressure,
Exactly.
the other factors, comorbid
Exactly.
conditions. So you need to go to ER
Exactly.
without any hesitation. What about children? Same applies? Pediatric?
It's hard for me to comment. I'm not a pediatrician, but I have 2 kids, and I think all of them should get. CDC recommends all of them getting vaccinated.
Would you recommend vaccination?
Oh, of course, yeah. I mean, right now we're talking about there's different strains of the influenza virus. There's the influenza A and B, and then this year we've got this H3N2 virus that is very different than any of the other viruses that have been around previously. So that's why a lot of the vaccines are not really working as well this year. But it's not to say that you can definitely have a couple different strains of influenza hit your community at once. So it's not only about getting vaccinated for this right now, the strain that's in your community now, but like in a month from now, maybe a different strain will come in. So you still need to get the vaccine because it does cover you for multiple different types of influenza.
What if you didn't get it till now? Should you go get it now?
Yeah, absolutely.
Definitely.
So don't wait. Go get your vaccine.
It's still not too late.
It's not too late.
I would say if you're sick right now, I probably wouldn't do it while you're sick. But the second you get better, I would just go get a vaccine. Absolutely.
Yeah, assuming you have no symptoms, and then I think it's still not too late, because after the vaccination, usually the prevention kicks in about 2 weeks after that. So you have a 2-week window during which you might not have the full efficacy.
We were going to take a short break. When we come back, we'll discuss this further. Thank you. Սեր պայգամներ, կարճ տատարեմ հետը պիտի վերաթարնանք մեր հայդակրին։ Սեր պայգամներ, այսօրվա մեր թեման է ինֆլուենզա էպիդեմիկը, որ շատ կարևոր հիվանդություն մնե, հատկապես երդասարդ անձով, բզդիկներուն և ձեր մարդոց միջև։ So այս թեմայի մասին գխոսենք երկու բժիշկներու հետ, որ մեր ստուդիոյին են այսօր։ Dr. Jandial, just before the break, we discussed the vaccine and the flu shot. So that's a controversial topic by itself. Some people are very reluctant to have that. I mean, I have it every year, and I don't know, for the last maybe 20 years I've been taking it. And why people are reluctant to get the shot?
Well, I mean, there's a lot of reasons behind it. One is they have some kind of experience in their memory where they got the flu shot and they, within a week or two they got sick. So there's this.
Sometimes it does happen.
Sometimes it does happen, but it's quite rare. I've never. I don't think there's any data to support that. Or you might have a local side effect, but and then there's some people who are just opposed to any kind of vaccination. They just think that
they don't want to take any vaccination.
Yeah, it's not just the flu. It's any kind of vaccination, and so I think you're doing a disservice to yourself in not getting the flu vaccine. The risks of any kind of serious side effects from the vaccine or life-threatening side effects from a vaccine are insignificant. I mean, it's so rare. I don't even think I've heard of any reported cases. But it's hard to change people's previous experience and try to break that. And then there's a lot of other people who just say, "Oh, doc, I never get the flu vaccine and I don't get sick. So why do I need it now?" So
everyone is different.
Everybody's
Obviously,
different.
Every person is a unique person. But what about healthcare professionals? Should we all get vaccine?
Oh, most definitely. Actually, in the hospital setting, we have to show that we have gotten vaccinated. And if you're not vaccinated,
no exception.
No exception. If you're not vaccinated or you choose not to be vaccinated, then you have to wear a face cover so you don't put other people at risk also. So it's, I usually don't, we have some people, as far as nursing who will resist that, but overwhelming majority of healthcare professionals in the hospital, they agree to it. They sign up to get it done. There's no resistance from it. In fact, they like it. It's very convenient. They just go to the hospital, get their vaccination. It's free of charge, and
Let me ask you this. So, since you guys are on the hospital side, what exactly does happen to someone in the hospital worker that refuses to get the vaccine? How do you guys handle that situation?
Well, according to the Joint Commission, they have to sign a statement indicating they're refusing and the reason why they're refusing, and we have to present that when there's a survey. We can't force someone.
You cannot force.
You cannot force.
We cannot force someone.
Okay.
But if they, for whatever reason, they refuse, a nurse or a physician refuses to take the vaccination, we will just document that, and he or she will sign it, the reason why, and we put it part of their file.
Would you require that person to wear a mask?
Yeah, I think
that's the rule.
That's the rule. At that point, if they don't get the vaccine, they have to wear a mask. Yeah.
So what do you recommend then? Should everyone be vaccinated? You tell your patient 100%.
I tell them all that they should get vaccinated. I understand, I understand the dogma right now with vaccinations, and I think that people are lumping everything together, and there's a systemic distrust for big business and big pharma in the community. And unfortunately, people just don't trust the makers of these medications. So that's what's happening, and then and so we're kind of, as a physician, if I go and talk to someone who has a pretty deep-founded mistrust of the system, how am I going to change their mind about it? It's very difficult to do. I mean,
right.
we recommend it. We offer it in the office, but you can't force it on people. You can't force it on people. But the problem is, if you don't get immunized, then it's a herd effect, because the more people that are not immunized, the stronger the flu epidemic will be that year. So it affects everyone.
People, read it. They read in newspapers, radio, television, saying only 30%. So that means 70% is not effective.
Exactly.
So that, gives this mistrust.
Absolutely.
Well, that's what I was alluding to earlier, is that if you talk to the infectious disease specialists, and I did actually today, the infectious disease physicians believe that even if you don't get complete prevention, you do get partial efficacy. Efficacy meaning that if you hadn't gotten the vaccination, your symptoms would have been much more severe and more life-threatening. So you get partial prevention, even if it's not complete prevention. So the vast majority of patients will get some benefit out of it, but the benefit can be variable from partial benefit to complete benefit. But people only focus on the data that's probably reported, which is 30%. Well, that 30% they had no episode of flu. And it's a challenge to get this message out.
Are home remedies alternative, let's say? I mean, there's this misconception among our community.
Yeah,
and I'm just trying to bring...
Limon, merlot, ori, yeah, of course, yeah,
maybe
absolutely.
cognac.
Cognac, of course, that's the best.
The perception we have is just like, okay, you know, I'm sick, you know, I go home, have a lemon, as you said, with tea, honey, and I rest. I should be okay.
I regularly recommend a little tea with honey. I think that's a very good home remedy, you know, in terms of sore throat and soothing and making you feel temporarily better. I think it's fantastic. So there's definitely a value to some of these home remedies. Some of them go overboard, you know, like people rubbing vinegar all over their body and putting newspapers. I don't know.
That's extreme.
It's more uncomfortable, actually.
Yeah. So I've never heard of vinegar rubbing all over your body.
I don't know. You know,
I haven't heard that one. The vinegar.
Some of these patients come in with this stuff on them. You know, like
vinegar all over their body.
You'll see it.
And that's supposed to cure flu.
They can.
You know, in the Indian community, when I was young, the vitamin C was really promoted as the cure-all, the panacea for any of these ailments. So I think this is kind of part of the phenomenon in every culture. They have their own unique remedy that they espouse. But you know, I think it's perfectly fine if you know, if you're relatively young and you don't have any chronic illnesses. You just got to write it out, and you don't really need a lot of treatment.
So when you're saying write it out, let's say if I'm sick, first thing I should do what? Stay home? Don't go to work?
I would definitely encourage.
Especially, I should not go to a hospital. That's what my work is. So I don't go to a hospital. Stay away, right? Because you're going to infect others. Yeah. And that's the theory behind it.
That's the theory behind it.
So how many days you should rest?
There's no magic number until you feel better.
Until you feel better.
You know, and one thing that, you know, I do want to talk about also is the Tamiflu. If you don't start it within 24 to 48 hours of the symptoms, it's not very effective. So I think that...
So immediately, right at the onset,
24 to 48 hours,
you have to start the Tamiflu.
For it to be really effective. And that's why they recommend you just call your physician, and you don't even need to see the physician in the office. They should be able to theoretically call the pharmacy.
I mean, really, there's even indication for chemoprophylaxis, which is basically if you have the flu and you're living with like your child and your wife, that all of them should be on Tamiflu at the same time. At the same time. Like a prevention. Yeah, prevention. But you know, in reality, with all these shortages, how
do you do it?
How do you do that? It's impossible to do that.
We will take a short break and we'll come back and discuss this further. Thank you. Սեր պայգամներ, գարչ թաթարեմ է հետո պիտի վերադառնանք մեր հայդակրին։ Սեր պայգամներ, այսօրվա մեր թեման է ինֆլուենզան եւ այս ինֆլուենզային պատճառով հիվանդությունները եւ so forth։ Մեր ստուդիոյի մեջ ունենք երկու բժիշկներ, որ այս թեմայի մասին պիտի խոսին։ High risk people, especially pregnant women. And I know Dr. Jandial touched on the, comorbid, diabetes, that category, high blood pressure and so forth. What about pregnant women? If they got sick with a flu, what do they do?
Well, pretty much you treat a pregnant woman like you would treat anybody else. And so currently the indications for prescribing Tamiflu is that you still prescribe it for pregnant women. There are currently there's no human data that shows that Tamiflu causes any harm to the fetus at all. So in these women that have high fevers and come in with classic flu-like symptoms, you should treat them with Tamiflu. And so they are at much higher risk. When you're pregnant, it's like you have another comorbidity, another disease process. That baby, it makes you...
It's another baby in our life.
It makes your body weak. So there's more chances of complications. And so we have to be very careful, have close monitoring, and make sure that these patients are getting better. it becomes very difficult in situations like in the emergency room or urgent care, where someone comes in and sees you that you've never seen before, and then they leave, and following up with these people becomes difficult.
But should they go back to their OBGYN?
Absolutely, they should.
I mean,
they
that's
should.
the first thing they should do.
You know, the interesting part is that, you know, if a patient comes in with the flu and they're, and it really depends on how many weeks pregnant they are, really, because
at what stage?
Yeah, because the first 20 weeks, the fetus is not viable. So if something happens to the pregnancy, it happens. It's a miscarriage. It's counted as a miscarriage. But after 20 weeks,
the first trimester.
Yeah, and after after
that.
Yeah. So after 20 weeks, you can actually take care of that fetus outside of the womb. You know, so the risk goes way up. And so this is when the OB doctors will be a little bit more hands-on in a later stage of the pregnancy, because if something goes wrong with the fetus, they should intervene and do something. So, but in the first trimester, it's usually actually the first 20 weeks. That's the time when urgent care doctors and the ER doctors are kind of dealing with these things on their own, kind of treating them just like everybody else.
Right. Dr. Jinnah, how about in the hospital setting? I mean, what are some of the severe cases you've seen this season, you know, in terms of high-risk patients, and what are some secondary, symptoms or secondary diseases that are coming down, not just the flu, but creating other host of other issues?
Yeah, no, that's exactly it. So if you have underlying COPD, underlying lung disease, we see that the patients who get influenza, they can develop respiratory failure. So their lungs don't work at 100%, so they need to be on oxygen, and in the worst case scenarios, they have to be intubated and started on a ventilator. Those are the ones that are really high risk for developing the complications of the influenza. And if you have immunocompromised state, that's the other thing. A lot of people don't think of diabetes as an immunocompromised state. Diabetes has all kinds of complications, but one of them is that it weakens your immune system. So that's why that population is also very susceptible to the serious side effects. And last but not least is that once you develop an influenza, there is a higher risk that you will develop a superimposed bacterial infection like a pneumonia. So somebody who has COPD, because they've been smoking most of their life, even if they've quit recently, they get the influenza, then they go into respiratory failure, develop pneumonia. So all these things kind of coalesce and you wind up being in the hospital. That population is always going to be high risk. And you know, they need to be treated with IV antibiotics and Tamiflu and breathing treatments.
So a lot more aggressive treatment.
Because their lungs are not at 100% capacity. So, but that's the population that we're seeing a lot of. And we're seeing a lot of 90-year-old patients in our hospitals. I mean, we've had like, at one point we had like 10, I would say 10% of the 10 to 20% of the patients were 90-plus-year-old patients. So, and those are the ones that are usually the ones that pass away.
Right. So when you hear these statistics, well, 33 people dead in LA County, over 100 in California, well, I keep thinking, who are these patients that are dying from flu? Well,
the easy way to remember is always the very old and the very young. Those are the two
categories.
And in the superimposed on that, I would say the people who have an immunocompromised state, somebody with a weak immune system. But it's usually the extremes of age. Those populations are the most at risk of having the serious outcomes.
I mean, the minute you have any symptom, what should you do? Call your doctor? What's your advice to our audience? What should they do? I mean, the minute you feel, and you don't know, maybe it could be cold, right? I mean,
exactly.
What's the difference between cold and a flu? Cold and, flu or bronchitis or something, What are these symptoms that people should differentiate and say, I need to go to ER right away, or I need to call Dr. Momjian and go see him?
Well, when people have
younger babies. I mean, if you get sick.
If somebody has the cold or an upper respiratory infection, those symptoms, those patients typically don't have high fevers and their whole body does not ache. That's the key differentiating factor. If you have mild fever and you have a productive cough, but you don't have the high fevers and this feeling like a truck just ran over you and you don't have any level of energy to get out of bed. Those are the key hallmarks that separate flu from upper respiratory infection. But yeah, I think people should call their doctor and try to get the Tamiflu over the, prescribed for them. But invariably, many of them will still want to go see their physician or go to the urgent care if they can't get an appointment with their physician, and if they're having shortness of breath and other serious, symptoms, and they go to the ER. So I think you have to individualize the recommendations, and that's why the best thing always to do is to call your doctor who knows your medical history, and they'll know right away, are you one of those healthy patients that really don't need to come in, or are you one of those high-risk patients that need more closer attention?
What about, babies? You have, babies in the house, let's say, and in the middle of the night, their breathing stop, or difficult breathing. What do? You just call 911?
Well, those you just call 911.
So don't wait to call your doctor. Don't wait till the morning and say, oh, let me call my pediatrician.
Yeah, if they stop breathing, it doesn't matter whether it's the
or
flu or
difficult breathing. Either one.
If they're having difficulty breathing, I mean, call 911 or race the kid to the ER right away. Those are the ones you don't want to take a chance on.
It definitely depends on how old they are, babies that are less than 3 months do not have a fully developed immune system.
Right.
And so if you have a baby that's less than 3 months old and they develop a fever, that is an emergency room visit, basically.
Immediately to the emergency room.
There's not much you can do. You have to go to the emergency room because, even a mild kind of like infection could be life-threatening for a very young baby. But when you get to like 4, 5, 6, 7 months,
a little bit more mature.
Most up to a year, toddlers and so forth, their immune system is very similar to an adult. Yeah, and so we still have to be very careful, but you're going to treat it like any other viral infection, and right. you'd want to, the problem with this year's flu was that it hit right during the holidays.
Holiday season.
It hit during the
holidays.
holidays.
Like a gift for the holidays.
It was a gift for the holiday, like right there, right between. It was like Christmas started and the flu started at the same time. Right. And so all the doctors that have private offices all were out of town, doing their holiday thing. And so all the offices were closed. And so it made it even more congested to
Were you open in this holiday season?
We were open, yeah. We're open, yeah.
So you all of a sudden seeing all these patients from the doctor's office that were closed?
They were all closed, exactly.
We're going to take a short break, and when we come back, we're going to talk a little bit about prevention. Is there a way you can prevent getting the flu? I don't know. Is there a way about besides vaccination, the flu shots? If there's any way you can avoid getting that, so we'll discuss that in a minute. Սեր պայգամներ գարչ տատարարը հետո պիտի վերաթանանք եւ պիտի խոսենք prevention-ի մասին կրնակ եթե առանց ֆլուի երթալ եթե կարելի է Սեր պայգամներ այս մերչին segment-ի մասին պիտի խոսենք prevention-ի մասին եթե կարելի է որ առանց ֆլուի երթալ եթե այդպես կարելի է պիտի հարցնենք մեր մասնակիցներուն Is there a way, short of vaccination, we discussed, is somehow avoid getting the flu?
Well, I think the two easiest processes that you should implement is make sure you wash your hands and stay away from other people with symptoms.
Who has symptoms?
Yeah,
stay away from them. So that's where you avoid them.
Yeah.
So even you avoid them, you take all these precautions. Can you still get the flu?
Yeah, I mean, I think right now it's so much. There's pretty much a pandemic out there that it's so easy to get exposed to.
Everybody's there.
If you're going to work, I'm sure it's.
Okay, should you go to work? I mean, that's first question. The minute you're sick, recommendation is from the health officials: don't go to work, stay home, don't infect others. Right?
I agree.
Absolutely, yeah.
Okay. And
don't go back to school.
Don't go back to school.
Don't go back to school.
Your child goes to school.
Absolutely.
Keep your child away from school because you're going to infect the other children, and that's faster infection. Okay. So what else they can do besides, not going to work, not going to school, stay home? And have tea and honey?
Isolate yourself.
Isolate yourself.
Oh,
okay.
man, yeah. Go to the store and buy 50 gallons of water and some firewood. And no, I don't think you really need to do that. I don't think you need to.
Okay. Well, that opens maybe another question, which is a little away from our topic, but let's talk about it anyway, is how do you stay healthy? I mean, you both are in the front run. I mean, what do you do? Just diet? Everybody says diet, exercise, have good genes. You know, probably that's more important than anything else. And what else you do in order to keep you healthy, away from a diabetes, away from high blood pressure, overweight, let's say. I mean, smoking.
Sure.
Drinking. I mean, all the stuff that our community does.
I tell people, you know, I think the most important thing to do is to get good sleep at night.
How many hours?
So I recommend that patients get like 7 hours.
That's the average 7 hours sleep.
7 hours of sleep at night. The studies have shown that people that sleep the correct amount get sick less frequently, and when they get sick, they get better faster. Okay.
So if someone says, you know, I know people tell me, some of them doctors, I sleep only 4 hours a day. That's what I need. So that's not a healthy thing.
That's, you know, everybody's body's a little bit different.
Even Trump says he sleeps 4 hours.
Listen, whatever your normal is, okay, you should be getting that, at least that much. The problem is most people are staying up way too late at night, and they wake up way too early to go to work in the morning, and so they leave themselves too few hours to sleep at night, and then they want to get better from their illness at the same time.
So what's the normal time you should go to bed? 10 o'clock, 11?
You know, depends on when you have to wake up in the morning. So
if you wake up at 6?
If you're waking up at 6, then you should go to sleep by 11 o'clock.
So you should have a good night's sleep, as they say.
Absolutely, yeah.
What are other healthy things? Diet, you mentioned. We mentioned. So diet is the key? Diet
is very important. You know, having a balanced diet, not eating too much carbohydrate, you know, too much saturated fats. You want to enjoy everything in small amounts.
Moderation.
Moderation, small frequent meals, not eating too late at night. You know, these are all very important
stuff. What about drinking? That's unfortunately is widespread in our community.
Yeah, you know, alcohol is always a tough topic to talk about because there's good data to support that it actually protects your heart. But if you drink it in moderation, you know, 1 to 2 glasses, if you're a man, and so that's the challenge, is that some people will not observe that moderation, that rule of moderation.
Sometimes you say, oh, let's have a little bit of vodka, might prevent me getting the flu.
Yeah, exactly.
So it's something that I think every physician struggles with, what to recommend.
What's the limit? Yes.
And also, should you even recommend that, because there's this potential for developing dependency. So I think clearly there's cardioprotective benefits from drinking alcohol, any type of alcohol. People say red wine, but I think there's data to support virtually any alcohol.
Absolutely.
But only if you have that discipline of being able to resist the urge to binge or develop this chronic habit of drinking, you know, to high levels and excessive levels, and it's a tough, you know, nowadays with work being so stressful, people, it's very easy to get into a trap where you come home every day and you have a drink as a tranquilizer to kind of deal and cope with your day's work, you know.
It sounds familiar. I don't know.
Okay. What about smoking and all this new stuff on, you know, recreation drugs that's been legalized and so forth?
Marijuana.
Marijuana
use.
Right. I mean, what's your opinion
you know,
on that?
like I
smoking, no, right?
Smoking, no. Obviously, you should
but
not.
But what
smoke.
about which was just recently been legalized in California?
I think it's not a good thing. What's happening?
It's not a good thing.
I don't think it's a good thing. So
would you prescribe it to your patient?
I am personally not a huge advocate of.
Somebody has in pain, cancer patient,
you know,
let's say.
I think that there are certain physicians that are better qualified than me to prescribe medical marijuana. I stick to just the traditional
medicine.
Yep. Yeah.
Okay. Exercise. You know, what type of exercise should someone do?
cardiovascular is the best thing. I think there's a tendency to think that you have to exercise quite rigorously and for an extended period of time to get the benefits of the cardioprotective benefits. But reality is, if you just walk or speed walk, whatever your limitations may be, you get benefit out of it. So you don't have to do a lot to get that.
How much time they should walk a day?
Depending on your age and your overall health, I think maybe 3 to 4 times a week for 30 minutes.
30 minutes, okay.
Yeah.
4 times a week, 30 minutes walk, or on a treadmill, let's say.
Yeah.
Okay. What else you can do? I mean, besides obviously having the right genes, because I see people 100 years old, and they say, "Oh, I smoke and I drink," So how do you do?
Well, I mean, I think one nice way to live to 100 is to move to Hawaii.
No
sit
stress.
on the beach and just relax.
Well, most of us can't do that.
That's the problem. That's the problem. So I think
actually Hawaii has all these obesity problems, by the way.
Well, I mean,
just FYI.
But there's actually interesting data or documentation of there are populations around the world where they have very high. They have genes that with a high longevity. Mm-hmm. People are living into the 100. We have one actually in California. It's in near Loma Linda. Okay, so and there's one population in Greece. The other one is in Japan.
Well, in Greece you have to live longer because there's no stress.
I think what did they say? Morro Bay. I think there's a couple different communities you're talking about there where people are living the longest.
Yeah, and really the hallmarks behind them is that they eat very limited red meats.
Okay,
cut
down on red meat.
Yeah, actually, or no red meats, and a lot of fruits and vegetables and fish. So it's mainly a plant-based diet. That's number one. And number two, and this is the interesting thing about it, they have a very tight social community. Now, there's no way to actually prove that actually is what's letting them live longevity. But if you look at these communities, they have a very strong social system where you see parents living with in the same house, multiple generations living in the same house. The grandparents are taken to all the social activities. So it's a very interesting combination. Yeah, and they tend to walk, in their communities. So natural means of getting some exercise, plant-based diet, a lot of social, very tight social network. And these are all the things, because loneliness is
absolutely depressing and so forth. So
that's
we can't be lonely people. I mean, we're on a planet that we need to interact with people.
Absolutely. I mean, he alluded to all the natural kind of beautiful parts of life, the family and the staying active naturally, continuing like some kind of a work late into your life, that you enjoy doing. All this is fantastic. I think when we start talking about like artificial means to try to keep yourself alive longer, it loses that flavor, the natural flavor.
Well, thank you so much. It was a real pleasure having both of you on my show. It was very informative, and hopefully our audience will benefit from all these great advices that we got from both of you. Thank you so much. Սիրելի բարեկամներ, կփակենք այսօրվա մեր հայդակիրը։
Հաղորդման հովանավոր Dignity Health Glendale Memorial Hospital